Well, good afternoon, everyone. Thank you for joining us today to discuss my profile page of the WPS Secure Portal. My name is Karen Curtis, and I'm a Provider Outreach and Education Specialist here at WPS. Today, I am joined by my good friend, Aline Sigler. Aline is going to be helping me out today by monitoring the chat for questions that you may have, and also providing some additional information during the presentation. The information presented in this webinar will pertain to individuals who have registered the WPS Secure Access Portal, also referred to as the portal. I do have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and you would like to, there is still time. A copy can be found in our live events page, which is located within the WPS Training Center. In our list of upcoming events, there is a column titled Materials, and this is where you're going to be able to find a link to the PowerPoint material. I will also have Aline add a link in the chat in case you need to get there quickly and get that downloaded. Our training center also contains a web page for our encore presentations. All of our webinars are recorded, and if there's no technical difficulties, we will put the recordings on our web page. Videos are available for up to 90 days and can be watched on our webpage without having to go to YouTube. We know that some of you may not have access to YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Now, recordings of our webinars can also be found on our YouTube channel, where they will remain until the webinar is redone or if the information has changed. Later, there will be a question and answer session if time permits. So if you have any questions related to today's topic, please send those using the chat feature. Now, if there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel there are areas where we can improve. And it also gives you an opportunity to provide input on what types of education you'd like to see in the future. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Now, here at WPS, we do our best to provide you with accurate, up-to-date education. The information that I am providing is accurate as of today. CMS also does prohibit the recording of this webinar. We are recording the event so that it can be posted as an encore presentation. The recording will be available next week if there's information you would like to review or if there's material that you'd like to share with coworkers. Now, today my goal is to provide you with a better understanding of the actions that can be performed on the My Profile page. I'll briefly discuss what the profile page is, and then we're going to get into the specific functions. So let's start with what is the My Profile page. Now, your My Profile page is all about you. It contains your personal, work, and business information, along with recertification dates. It also allows you to update both your personal information and billing provider credentials. Now, although we will go through these in more detail, this is also the place where you can access different user account functions. A couple examples would be changing your password or your security questions and answers. And while there are differences depending on the type of access you have, the My Profile page is something that's going to be available to everyone regardless of what your access level is. So I wanted to start out by showing you these examples because your screen may look a little different depending on what type of user you are. Now, I thought it was important to acknowledge this because it really pertains to all of the portal education that we do. The picture that you see on the left is what it's going to look like if you have eligibility access. So eligibility users have access to their own account, eligibility checks, NPI lookup, and customer service. On the right, you see that what it looks like for a standard user. They have a column that's titled Practice, and the My Profile is their very first option in that column. You'll also notice that a standard user has other functions related to their facility or practice. Now, if a person were an NPI administrator, their view would look very similar to the standard user, except that they would have an additional function that's titled Users. And that user button would appear directly under the My Profile button. So again, I wanted to address the differences so that when you attend other webinars for the portal and you're looking at it thinking, my screen doesn't look like that, I just want you to know it could be because of your access level. So let's move on, and we're going to take a look at the different functions that can be performed. So when you choose My Profile, you're going to be brought to a dashboard. And here you're going to find your personal information, your billing credentials, and a section that's going to be for quick links. Here's a look at the dashboard. I mentioned that you can edit your personal or billing credentials. So up here in the upper right corner, you can see that there's an edit button. Selecting this button will open the fields and will allow for changes to be made. Then when you've completed those changes, you'll just hit save. The done button that you see right next to it simply means that you're done with the My Profile dashboard and it's going to close. Now here you're going to see there's a light blue banner and there's a link to report security incidences. This would be instances where activity violates CMS information security policies or that compromise information security. You will be asked to provide your user information along with details of the incident, including date and time. So as you move down the page, you're going to have all these dark blue buttons, and these are the different actions that can be taken on your account. I already mentioned the password and security questions, but you can see here, there's also where you can recertify or you can disable your account. Next, you're going to have all of your personal information, your user ID, name, work address, direct contact information such as work number and email address. You're also going to see the date when your next recertification is due. So right here, that'll let you know when you need to recertify. Below that, you're going to have your billing credentials. So this is going to include the NPI, tax identification number, provider name, and PTAN. At the very bottom down here is an area where you can have quick links. Now we're going to go through each of the functions that can be performed, and we're going to start with the My Service locations. I realize that a lot of the information here is blacked out, and that's because even though these screenshots are taken from a test environment, they could mimic real providers. And while some providers don't care if their information is shown because it isn't quote real scenarios, there are other providers who may not want that information out there. So for that reason, we black out details so that it's not shared. My Service Locations options allows you to view, manage, and modify NPIs where you have access. Here's where you can view your primary service location, you can resolve blackout NPIs, and you can remove access to an NPI. Now, NPI administrators can determine if there are any pending locations that still require approval, and they can modify their level of access within an NPI. The practice locations that populate in this view come directly from Medicare's enrollment records. So if you feel that an address is incorrect, you will need to log into PACOS and verify that the address on file for your group is correct. This action must be taken by a practitioner, an authorized or designated official for the provider organization, or the official contact person for PACOS. Now, for those of you who may not be familiar with PACOS, it stands for Provider Enrollment Chain and Ownership System. So kind of think of this as a master record for Medicare providers. Now, your primary service location, so this up here at the top, this is going to be the NPI that you use most often when you look up information. By default, it will be the NPI that you used when you registered for portal access. So if you would like to change the NPI listed here, this can be done by updating your provider billing credentials on the My Profile dashboard. Now, if you had service locations that were pending approval by the NPI administrator, there would be a section kind of right in between here, in between the My Primary Service location and the My Service locations. There'd be a little section in there and it would say My Pending Access Requests. It's going to look a lot like the My Service locations, and it's going to have the NPI location, the practice name, practice address, all of that, and it's going to show that it's pending. And that means it's waiting for the NPI administrator for your group to approve that. Now, this particular user has quite a few service locations. The facility or practice information will be listed along with the types of access that you have. The little silhouette over here with the magnifying glass under the admin, that's will show you who the NPI administrator is for that NPI. Lastly, you have these little trash cans. That's going to be if you want to delete an NPI from your list of service locations. So maybe you're not going to need access to a specific NPI. You're not going to need to look up claim information. You can just delete that. The next option is change my password. One thing I do like about this is that it shows you all the password rules and you're going to get a green circle with a check mark in it when you've met that requirement. I kind of wish they had that box for us. I think it'd be helpful. Now, portal staff have mentioned that sometimes password changes can cause issues. They have provided a resource with some tips to help you create a new password. I do want to take you out there quickly. Let me get this up. So here is the WPS homepage. You don't have to log in to view any of this information, but you can go over here to the portal user manual. I'm going to scroll down here and I'm going to click on my profile. And scroll down. Sorry if this bothers anyone. So down here under the change my password, there's a link for user login ID and password setup management. And the WPS portal staff came up with this just because there were some issues. So they wanted there to be something that users could reference so that they didn't have such a hard time with passwords. You can see here it's got all the specifics for creating your ID and password. So if you scroll down, it does have, they gave some helpful suggestions. There's also some rules. And then there's also an option where you can have the portal auto-generate a password for you. You do that by clicking on the Generate Password button, and it's going to auto-fill the new password and the confirm password fields. Now, this is something you will need to remember the next time you log in. So if you have a hard time remembering random numbers, letters, and symbols, then this may not be something that you want to do. I know that I personally always have to use one of these tricks. I have to come up with something that I'm going to remember, and then I have to start adding numbers and symbols to it. But I did want to make you aware that that is an option that you can use. And right here is where you have the generate password. Now, once you've completed all the information, then you can go down here and click submit, and it's going to save your password changes. Now, I know with us, because we don't have this, there's times that we'll have to enter 3 or 4 passwords until we get one that the system likes. So hopefully with the password rules being there, you won't have that issue. Now, when you initially register for the portal, you are going to be required to set up a multi-factor authentication. This is because CMS requires contractors to use this tool if in secure areas of their website. It provides an additional layer of security for both patient and provider information. Now, during the process, you would have provided an email and a telephone number to receive a verification code. But what if your email or your phone number changed? Maybe your name changed, so your email address needs to be updated. Maybe you got a different position and your phone number changed. So to change any of these, you're going to choose the multi-factor authentication in your My Profile dashboard. You'll enter the new email address or new phone number and select Send Code. Then you're simply going to enter the code and you're going to click Verify and Finish. Now, if it's successful, you're going to receive a green check mark with a message letting you know that it was successful. Now, in this example, a Google Authenticator was not set up, but if that was something that you did do when you registered, you will have the option to unlink the Google Authenticator. Now, all users are required to recertify their accounts annually. This process helps protect patient and provider data by making sure that those individuals who need to access the data will access it properly and use the information for legitimate purposes. Users who fail to recertify their accounts by the recertification deadline will have their accounts deactivated. Now, there are a couple of ways that a user can be made aware that it is time to recertify. First, a warning like the one shown here will appear on your dashboard with the date your account will be deactivated. This warning will appear 90 days prior to the deadline to allow the user plenty of time to complete the recertification steps. The date shown is in the warning is the date you lose access. So you're going to want to make sure that you complete that recertification before that date. Now, another way that you may receive notification that it's time to recertify is through your NPI administrator. So when accepting the role of NPI administrator, one of those responsibilities is to remind users under their NPI that they need to complete their annual recertification. It is important to note that users will not receive an email notifying them that they are due for recertification. And the reason for this is because WPS wants to make sure that only active users have active portal accounts. So that's why all of these warnings are either going to come through the portal itself or they're going to come through your NPI administrator. Now, let's take a moment to talk about the actual recertification. There are a couple of ways to start the process. In the warning on the previous slide, let me go back to that. There's this red button here that says recertify my account. So you can click on that and it will take you to this form. But there's also a button on your My Profile dashboard that's titled Recertify. So either option is going to allow you to start the process. This is going to open the form. It's going to have a few sections that need to be completed. The first that you are going to be presented with the terms of use. Section 1 is transactional and Section 2 is general. Then at the bottom of that, there's going to be a box for you to check stating that you read and agree to abide by the terms of use. The portal requires that all users attest to have completed their company's annual security awareness training. There is a warning that lets you know that if you select no, your account will be permanently disabled. The last section is going to ask for you to enter provider credentials for any of the service locations that you currently have access to. So this is going to include the NPI, the PTAN, and the tax identification number. You can see that's down here at the bottom. You'll then hit submit, and that'll submit your form to recertify. Now, in some situations, you may need to request access to additional NPIs. Typically for healthcare providers such as physicians or nurse practitioners, they are only eligible for one NPI. So if you would work for a physician's office, you may only need to access to one. Now, if you work for a healthcare organization such as a hospital, a nursing home, or a physician's group, you may need to have access to multiple NPIs in order to bill for services, to check for claim status, things like that. So in these cases, you're going to click on the button in your My Profile dashboard that's titled Request NPI Access. It's then going to open a screen that looks like what you see here. Now you will need to enter the NPI, PTAN, and TIN for the location that you want to access. Depending on the number of NPI administrators, you may get asked if you would like to request admin access. In this example, you can see it appears right here under these boxes where you can either click yes or no. Now, if you select that you would like to request admin access, there are going to be certain financial information that must be provided so that you can access and the information has to appear on a recent remittance advice. There's going to be three options. You'll have patient lookup, which is going to require the Medicare number and date of service for a beneficiary who would appear on a recent remittance advice. You can choose check number, which is going to require you to enter a check EFT number. And the last option is going to be Medicare claim number. So that's going to ask for a claim number that has appeared on a remittance advice within the last 30 days. Now, if you select no, or if you're not given the option to register as an admin, then your request is going to remain pending until it's been approved by an NPI administrator. Now, changing your security questions is another option that is available. You will be required to change your security questions during your annual recertification, but it can also be done at any time by selecting the Change My Security Q&A button on your dashboard. Once the selection is made, the page shown here will appear. You can see that there's three boxes for questions. Each one has a drop-down box. There are quite a few questions that you can choose from. There's standard ones like the make and model of your first car, questions regarding like where you were born, your sibling's middle name, your kids' middle names, things like that. But there's also ones such as what your favorite book or author is, or your favorite candy, or your biggest pet peeve. So there's really a lot that you can choose from. I personally was surprised by the number of questions they had. Below each question box is a place for you to type your answer. When finished, you're going to click Save, and a message is going to appear that your questions have been successfully updated. Now, before I get into actions that can be taken by clicking on the Blackout NPI option, I want to discuss what causes a Blackout NPI. Every NPI used to access the portal is going to require at least one person to accept the role of NPI administrator. Now, I've mentioned this position throughout this webinar, but I haven't really gotten into what they do. Administrators take on a role of being responsible for all users under their NPI. They approve or deny requests for access. They notify users when it's time to recertify. They even help users with password changes and disabled accounts. So just like eligibility and standard users, NPI administrators can lose access to their accounts if they fail to log in at least every 30 days, or if they don't complete their annual recertification. Now, if all of the administrators lose their access or disable their accounts, then the NPI is going to move to a blackout status. So when this occurs, standard and eligibility users will continue to have access for 30 days. This allows the previous NPI administrator time to regain access to their account, or to maybe have another individual self-register as a new NPI administrator. Now, if the Blackout NPI remains without an administrator for 30 days, then every single user is going to lose access to that NPI. So when looking at your dashboard, if an NPI that you have access to has been put in blackout status, there's going to be a red circle within the Blackout NPI button, and it's going to contain a number to show how many of those NPIs have been put in blackout status. So in order to correct the issue, the existing NPI administrator will need to correct their access, or a new person is going to need to step into the role. So if you click on the Blackout NPI option, you're going to see a screen like what's shown here. It's going to list the NPI practice name and address, which require attention. Under the actions header, so over here on the right, there will be an icon of a person with a check mark. So if you choose to register as the administrator, you just simply click on this icon. Now you will be provided with the role responsibilities. You're going to be asked to decline or accept. If you accept, you will be taken to a screen where you're going to need to provide financial information from a remittance advice. So that's kind of what we went over earlier. You're going to have those three options, and you're going to have to provide one of those three options. Now, if no one accepts the role before the 30 days is up, and if all the users lose access to the NPI, then all users are going to have to start over and request access by selecting the Request NPI Access button in their My Profile. Now, at least one user will need to agree to accept the admin role so that they can approve all the other users' requests for access. So the last function that I want to talk about today is Disable My Account. This may occur if your job changes and you no longer need access to patient eligibility or claim information. In these cases, you would want to disable your account. So from your dashboard, you're going to click on the Disable My Account option. The screen you see here will appear asking if you are sure that you want to disable your account. And you're simply going to click on the red button that you see in the lower red corner. The portal will take action immediately, and it's going to display a message that the account was successfully disabled. Now, there is another situation that may require you to take action like this, is if you have multiple accounts. Now, WPS recommends that you only have one user account per person unless there is a business need to have separate accounts for each NPI. Now, if you do have multiple accounts and you would like to combine them, there are steps that can be taken. You can log into your account that you no longer want to use, and you'll follow the steps that we mentioned here to disable the account. Then you're going to log into the account that you plan on keeping, and you're going to add all those disabled accounts using the Request NPI Access button on the My Profile dashboard. So those would really be the only two times that you'd want to disable your account. Well, I did not receive any questions during the registration process, so I want to ask Aline if there has been anything that has come through in the chat.
Thanks, Karen. That was really informative to learn all of those different things. And looking at the chat, we do not have any questions at this time.
Okay, thank you so much. We will go ahead and move forward. Now, after the close of today's webinar, you should receive a thank you for attending email. Here is where you're going to find your certificate of achievement and contact hours for continuing education units. This email also contains a link which will give you another opportunity to provide feedback. If you don't get this email, please check your spam or junk folder. You will also need to add messenger@webex.com to your safe sender list, and that will help you avoid any issues in the future. Now, if you joined only by phone, you will not receive this email. So in those cases, we ask that you send an email to the education mailbox, that you include your name and the phone number that you used to join, and that way we can email a certificate to you. Now, if you do think of any questions after the webinar, you have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff know that your question is related to this webinar, and they'll send it directly to me. If you do have anything that's claim specific, like if you have a certain situation where you've looked up claim status and you aren't able to find it, those questions would need to go to customer service. Now, when you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Aline add a link into the chat. And your feedback really does mean a lot to us. We review what you have to say, and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you would like to see us provide education on in the future. So if you have something specific, please add it in there. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us that too. We're really open to ideas and would love to have your thoughts. The redirect is going to look like what you see here at the bottom. We don't have any control over how this appears, so we just want to make sure that you know that it's not spam, it's nothing malicious. If you click on the blue continue button, it will take you to the actual survey. That brings us to the end of today's presentation. On behalf of myself, Aline, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I really hope that you'll join us for future events. You may now disconnect.